Hello, welcome to the AlumierMD Online Training Academy. My name is Victoria, I'm a clinical educator for AlumierMD, and in this video we'll be exploring the benefits of chemical peeling and peeling acids. Why do we call it a chemical peel? Well, there are two different ways that you can exfoliate the skin, mechanically and chemically. Mechanical is when you physically remove dead skin from the surface of the face. Chemically is when we lower the pH of the skin, forcing an acidic environment on the facial skin which is encouraging dead skin to remove itself from the skin. This is called desquamation. By lowering the pH of the skin, we snip the keratin bonds that keep dead skin cells attached so that they can shed in the days following a chemical peel. Essentially, a chemical peel is a way of exfoliating the skin. If we remind ourselves of the anatomy and physiology of the epidermis, we have 5 major layers in the epidermis, starting off down at the basal layer where the skin cells are brand new. You can think of these skin cells molecularly a little bit like a grape. They're full, they're juicy, there's lots of intracellular fluid, there's solid DNA information, and there's a very strong cell wall which you could peel a little bit like the skin of a grape. As a new skin cell layer is made, it pushes the previous layer onwards and upwards through the layers. This grape-like cell will eventually migrate through all 5 layers of the skin, eventually becoming a Walker's crisp-like dead skin cell on the surface. Eventually the cement that keep these cells together will dissolve. This skin cell will then shed off. This is called your cellular migration or cellular turnover. In youthful skin, this process will happen within 28 days, meaning within just 4 weeks the body will have made a new skin cell, it will have migrated all the way up through the layers, become a dead skin and shed off. This means a young skin is very good at rejuvenating itself and very good at repairing and replacing damaged tissue. Damaged tissue could be anything from a scrape in the skin right the way through to sun trauma or sunburn. Unfortunately, when we age, the cellular production in the basal layer slows right the way down, meaning that the body doesn't make as many new skin cells. That migration is a little bit slower, and so by the time that the skin reaches the surface of the skin where it's visible to the naked eye, it could be up to 50 or 60 days old. This means the skin isn't as good at rejuvenating and replacing damaged tissue, and that can cause and lead to skin conditions such as aging, pigmentation and acne. By performing a chemical peel, we lower the pH of the skin and dissolve the keratin bonds that keep these dead skin cell layers attached. The body responds to this missing dead skin by triggering the production of new skin underneath. Now, when you perform a chemical peel every 2, 3 or 4 weeks, depending on client indication and skin type, we can trick the body into behaving like a more youthful skin. This leads to new production of skin, increased shedding of dead, dull skin, leading to a youthful, more radiant complexion. Not only can we help to enhance the appearance of skin conditions such as aging, acne, rosacea and pigmentation, we can also help to enhance the penetration of the correct adjunctive skincare your patient is using to enhance their patient outcomes. When there is an excessive buildup of keratinized dead skin on the surface of the face, this can inhibit the penetration of vital home care products prescribed by you, the medical professional. By removing this superficial dead skin, we allow peptides, antioxidants and hydrating ingredients to reach the lower layers of the epidermis where they can affect change, meaning that your client experiences maximum potential from their aesthetic treatments and home care procedures. There are a number of different acids used in chemical peels to target different areas of the epidermis and hair follicle depending on the skin condition that you're trying to treat. Lactic acid is an alpha hydroxy acid, meaning that it's hydrophilic. Hydro meaning water and philic meaning loving. This means lactic acid plays with the water in the upper layers of the epidermis and helps to dissolve the keratin bonds that keep dead skin cells attached. This is known as an epidermal exfoliator. Salicylic acid is a beta hydroxy acid. This is known as lipophilic. Lipo meaning oil, philic meaning loving. This means that it loves oil. So it almost bypasses the dead skin entirely, enters into the hair follicle where it can exfoliate and break down excessive sebum and dead skin that can lead to acne congestion, including whiteheads and blackheads. Resorcinol is an ingredient which is lipophilic and hydrophobic. Hydro meaning water, phobic meaning repelled by. This means that it's driven away from the water in the upper layers of the epidermis and can achieve a slightly deeper epidermal exfoliation. You can select your chemical peel based on the ingredients you believe would benefit the patient's skin, based on their skin type, their skin condition, and also based on the performance of the skin on the day. You could do an individual chemical peel with a single acid, such as AHA or BHA, or you could perform a combination peel using alpha hydroxy acids and beta hydroxy acids to exfoliate both the epidermis and the hair follicle at the same time. Be sure to take note in your consultation of your patient's facial diagnostic and consultation to help understand the skin concerns that they would like corrected. Don't forget to hyper-customize your treatment, patchwork the ingredients that will help benefit the specific area of the skin that needs the attention. If you would like more help or support identifying the acids suitable for your client's skin and hyper-customizing your treatments, or would like to know more about the benefits of chemical peeling, please contact your regional business development manager or your regional trainer who will be happy to offer you more information. Thank you for watching.